Dr. Jeff, and today I'm going to talk a little bit about weight loss, a little bit about our weight loss philosophy in our office, a little bit about some of the HCG weight loss programs, the vitamin B12 weight loss programs. A lot of this, I know weight loss is confusing. Everybody wants the quick fix, so you got all the latest and the greatest supplements, out there as far as weight loss. But first of all, why believe me? Believe me because I'm a doctor? Well, maybe. But there's a lot of doctors out there that are very knowledgeable and very overweight. So the reason why I would say is why believe me is just because I myself was overweight. I think my worst, I was around about 270 so pounds. I finally got tired with it, got my act together. Nutrition, diet, exercise, ended up dropping down to about 205. I've kept that weight off for quite a few years now. I went from a couch potato to competing in the Ironman distance triathlons. And why believe me is, like I said, I've been there, I'm walking the walk. I believe, when I was trying to drop weight initially, maybe I tried some of these, gimmick stuff. As far as HCG and the vitamin B12 and whatever is going to come up next week, here's all I want you to do is I want you to just Google HCG diet, Mayo Clinic, vitamin B12, Mayo Clinic, next latest and greatest weight loss supplement, Mayo Clinic. Do a little bit of research, okay? If you do that, that typically gives you to a web page or the links that has a nutritionist from the Mayo Clinic. They're very straightforward and to the point. As far as the HCG goes, do a little research, type in HCG, Mayo Clinic. You'll see that they say no study has ever been done to show that this has anything to do with weight loss. Same thing with vitamin B12. When you're thinking about these supplements, use a little common sense, people. Okay, if there was a latest and greatest supplement injection out there, wouldn't every nurse or healthcare professional or doctor be using it and be lean? And is that the case? Walk into any dentist's office, walk into a doctor's office, family practitioner, walk into a cardiologist's office. Come on. A lot of these healthcare professionals are extremely overweight. So if this stuff worked, they'd be using it, they'd all be thin. Okay? So stop wasting your money on this garbage fad diet. This HCG thing, are you kidding me? 500 calories a day is for the diet. No, of course you're going to lose weight on 500 calories a day. You know what? If you're so set on doing that, just follow a 500 calorie diet a day. Okay? Forget the spending money on the supplement. You're going to lose weight. You're also going to lose some muscle mass. Okay? It's not a healthy way to lose weight, but if you're set on trying it, try something without the HCG. Give me a break. I can't believe these clinics are using this stuff, okay? There are ways to do low calorie that could get you a boost, but then you need to be taking some other type of supplements and stuff to minimize the weight you're going to lose from the muscle mass, okay? So my point is, with this little video, use a little bit of common sense, okay? Look at the people that are recommending some of these supplements. Google HCG diet, weight loss. Google vitamin B12, weight loss, Mayo Clinic, add that on to the end there. Do a little bit of research, see what these other doctors are talking about. Bottom line, if you take 500 calories a day and do that for a few weeks, you're going to lose weight. You're also going to end up shriveling up. You're going to end up looking like a little old person that's very frail and has very little bit of muscle mass. When you're serious about losing weight, see someone who really knows what they're talking about, see someone who's been there, see someone who's done it. Check our website out. I'm not going to get into a lot of our program right here on this video. The main point of this is I'm just really sick of all these fad diets, gimmick supplements out there. I know weight loss is frustrating. There's ways to do it. You can do it through sound nutrition, exercise. We send our people out for lab work. We're looking at some hormonal stuff. You may have some hormonal issues that may make it more stubborn to drop weight, but use a little common sense, do your research before you waste your money on a bunch of gimmick supplements. you're watching this, it's telling me that you have some interest in our weight loss program or in losing weight. So what I'm going to do is just take a few minutes and give you just a brief outline on our program and what it entitles and how it works. One thing I would like you to do though, I'm really tired of all these fad diets, these gimmick supplements. If you're looking into some of these fad diets or gimmick supplements out there, I would just ask you just Google that and then type in Mayo Clinic after that, okay? So type in vitamin B12 weight loss Mayo Clinic. And what you should do is you should be linked up to a website from the Mayo Clinic where there's a nutritionist from the Mayo Clinic that briefly describes these some of these supplements or some of these claims that some of these people are making. If you do that for the vitamin B12, you'll be sent to a website on the Mayo Clinic that says the nutritionist from the Mayo Clinic, in a short, brief paragraph, just tells you right off the bat, no study has ever been done that vitamin B12 has anything to do with weight loss. Short, simple. It's not for me, it's from a nutritionist that works for the Mayo Clinic. Do the same thing for the HCG diet. Type in HCG diet, Mayo Clinic. It'll send you to a link that goes to the Mayo Clinic, and use their advice. One thing I do is I tell everybody, as far as some of these diets and some of these other doctors are making all these claims about weight loss out there, is if there was one supplement, one injection, one quick fix, wouldn't all the doctors and nurses know about it? And wouldn't they all be lean and fit? They're not. Walk into any doctor's office, walk into any hospital in the country, and you're going to see a ton of health care providers that are extremely overweight. So just think about that a little bit once you're thinking about spending money for some of these injections and all these supplements for weight loss. I'll give you a brief outline about what our weight loss program entitles and how it works. We follow a basic outline for everybody, but our weight loss programs are customized to your specific needs, your abilities, your goals, your issues, your past history with weight loss. I'm basically acting as your coach. You have unlimited access to me. You can call me, you can email me. Whenever you have a question or a concern about your nutrition or your exercise program. So I just want to make that clear, that you're just not thrown into a standardized process as far as a weight loss program. The way our program works is you just come in for a consultation with me. If you're not in the area, we can do this over the phone. What I like to do is just to get to know you a little bit, try to find out what your goals are, your past issues with weight loss, what type of programs you had in the past, what worked for you in the past, what maybe didn't work with you. Then based on that, if we decide to move further, what we're going to do is I'm going to more than likely send you off for some type of lab test. We're screening for a few different things. We're looking at your glucose levels, your triglyceride levels, checking you for diabetes. We're also checking some hormonal markers. There might be some issues with some hormone or thyroid issues that may make it a little bit harder to lose weight. I want to make this clear though, this is not a supplement program. We don't send you for labs, find out that this hormone level is a little off, give you this supplement and all the weight comes off. It's a piece of it, but that's not the clear answer. If you have issues with some of these hormones, yes, it's going to be harder for you to lose weight, and we are going to address that, but that is not the entitled program. So what we're going to do is we're going to send you off some lab tests. Based on those results coming back, we may recommend some type of supplement for you to help you with that. The other thing what we're going to do is called a VO2 metabolic test. And the VO2 metabolic test is going to tell us where you're burning fat at various heart rates. You're going to basically put on a mask on. We're going to have you exercise with some ability. Based on how you're exercising and the ratio of carbon dioxide to oxygen you're kicking out and taking in, what we could actually do is we actually see where you're burning fat as fuel. So we can actually see how your body burns fat. where it burns proteins, where it burns carbohydrates. Lots of times we do this test on people and they're exercising at such a high level of heart rate where they're not burning fat efficiently as fuel. They're burning purely carbohydrates. These are the people who are exercising all the time, are not losing weight, might be extremely hungry after the workouts. I won't get into a lot more information that you can check some of my web pages out that calls a little bit more detail about the VO2 test. But that adds a big insight to your exercise, to actually see where you're burning fat as fuel. So we're going to send you for lab tests. We're going to do a VO2 metabolic test to determine where you're burning fat as fuel. Then after that, it's kind of up to you. What do you need the most help with? Do you need to come into the office here and do some exercise? You have no problem exercise. You just need to give the right training program. So that's when we sit there and we could do the lab test, we could do the VO2 test, we could give you that information, and with that information you can just go and run with it if you want. Now, most of the programs that are more supervisioned work the best for obvious reasons. So some people, what they do is they will come in here a couple times a week and do some of the strength training in our office. We write up a plan, tell them what to do for that exercise session. We watch them, review them. Other times people do some of the other exercise on their own. You can do a combination. Like I said, this is not a one-size-fits-all. We have found what seems to work the best. But then we're going to work with you. Okay? Some people come in once a week just for a weigh-in. You're going to be emailing your nutrition to me on a daily or every couple days basis. What I do with the nutrition is I treat the nutrition like a course or what homework assignments. What I'm going to do is basically give you a couple brief outlines or key points to follow. Then as you send me the nutrition, we're going to adjust based on what we see. Everybody's different. Some people do great eating 5-6 meals a day. Other people don't. They just like a couple, 2 or 3 meals a day. It's okay. We can work with you, on that. We're going to track your nutrition and see how, not just on what you're eating, but how are you feeling after you eat. I mean, some people are this big no carb thing. Some people need a little bit more carbs. What we're going to do is we're going to track what you're eating for your nutrition, and then see how your weight's coming off and see how you feel. Based on that, what we could do is say, hey, you need to increase your carbs a little bit. You need to increase your fats. You might want to try this protein. It really depends. I do want to stress the point that we're your coach. Okay, we're here to help you. I've been there. I know what it's like. I used to weigh about 270 pounds myself, about 205 now. I've kept it off for quite a few years. So I know how frustrating some of this weight loss can be. I also know how there's a ton of misinformation out there. You're always getting the latest and the greatest little supplement, the fad diet, the exercise program. That's where we come in. You can look at that. You can call us up. Hey, what do you think about this? I saw this. We'll give you our input. Bottom line, we're here to help you. We're not trying to sell you a bunch of gimmick supplements or DVDs. We're just here to try to help you lose weight. So if you're interested a little bit more in program, go to my website. It gives you a little bit more information there. Drop me a couple emails. Many times I talk with the patients quite a bit over the email before they actually come in for the consultation. So if you have some questions about the weight loss or the weight loss coaching, like I said, drop me an email, give me a phone call, we'll come on in, look over my website a little bit, but keep in mind we could customize everything to exactly what you need. So I look forward to seeing you.